Hello and welcome to Dr. Nora's Clinic. As some of you may know, I'm a non-surgical injectables trainer teaching cosmetic injectables to doctors, nurses and dentists all around Australia, from Melbourne to Sydney to Brisbane. And in this series of videos, I'll be sharing with you some safe techniques for injecting anti-wrinkle and dermal fillers. All surgical procedures carry risks and complications, and this is no different to cosmetic injectables as well, where the complications can be as severe as blindness. So therefore it is really important that you guys go to a fully accredited course to learn your cosmetic injectables training. Now, before I treat my patients, I always make sure to take pictures so that I can show them the comparisons at their 2-week follow-up. And to do this, I use my trusty iPad and the Treatment Pad app, which helps me to align the photos precisely. And raise your eyebrows and frown for me and relax.
Here's a sneak peek of Ash's before and after pictures. On the left you can see his before picture and on the right his after, and as you can see, his frontalis muscle no longer has those strong dynamic lines that we saw before. Moving on to his frown, his before picture, he looked pretty angry, and on the right he doesn't look so angry anymore. That's fantastic. Alright, let's get back.
As with any procedure, cleanliness and hygiene is of paramount importance. Of course, I'll be using injections that are sterile into my patient's lovely face. So what I need to do is make sure that the area is clean to avoid any infections. I'll also be using some clean gloves as well, and I will be telling my patient as I go along and reassuring them that the injections are almost done. How are you feeling? Good. All right. First up, it's time to clean the area with some chlorhexidine wipes. Now, bear in mind that chlorhex is ototoxic, so keep it away from the eyes, guys. If you need to, you can use alcohol wipes as well. Okay. Just look towards me, please. Just close your eyes. All right, let's clean up your forehead. Great. Now, I'm all for landmark injection, which basically means that I place dots on the areas that I want to inject. This will then help me to make sure that 1, I'm in the correct area, and 2, when I'm going along, I can wipe off the mark so I know where I've injected, not to duplicate my work. Okay, looking towards me please, Ash, and raise your eyebrows up for me as high as you can go. Perfect, and frown. And relax, and frown again for me. Lovely, and relax. Now that my patient is all marked up, it's time to get injecting. Of course, I don't want to be injecting those white marks into his forehead, because what I could inadvertently do is cause him to have a white tattoo, which is not cool. So before I get injecting, I'll be rubbing off those areas, making sure it's still a clean area, and then I'll get injecting. All right, raise your eyebrows up for me. Yeah, eyebrows up, perfect, and relax. And just looking towards me a little bit, thank you. And sharp scratches as we go along. And up, and relax. And up, and relax. Beautiful. And just looking towards me, and up, and relax. And up, and relax. and up and relax. Now that the forehead lines are done, I'm going to continue on to get those spot lines that will appear if I don't treat them. Raise your eyebrows up for me and relax. And the other side, eyebrows up and relax. Once you've finished your forehead injections, always dispose of your sharps in a sharps bin. Now, as you'll note, for the frontalis injections, I used a very superficial injection. Because that muscle is so thin, it's not a deep muscle, it only requires a 20-degree angle of injection. So 20-degree angles in those areas where you can see those dynamic lines, and just stagger it along the forehead, give you a nice, even injection point. So now it's time to move on to the frown, and for this I've already got my product already in a new syringe, and again I'll be using my claw hex wipe to clean off those white marks before we get injecting, because we don't want to give them a tattoo. Or do we? That's the question. Alright, here we go. Gauze at the ready, and we're off again. Okay, so give me a nice big frown for me. Lovely, and we're getting that procerus muscle, capturing it with the big belly there. And we're going deep 90 degrees all the way with the depth of the needle, sharp scratch. And just holding it for a couple of moments and then letting go. There we go. And now it's time to hit the heads of those corrugator muscles. Now for this injection, I always like to support the corrugator with my thumb, and that will just help to stop the diffusion of the product going down into the eyelid. So with this one, we again ask the patient to frown for us, and we support it with the thumb. And I can see there that the head of the corrugator is nice and prominent, and I'm going at a 45-degree angle with about half the depth of my BD syringe, and off we go. And just relax again for me, and frown, and relax. And just giving it nice support thereabouts, about 5 to 10 seconds. Again, just for the product not to diffuse into a surrounding muscle that you don't want it to go into. And now the same for the other side. Frown again for me, and relax. And supporting again with your thumb. Perfect. Last two, so we're now going to do the tail of the corrugator, which as we know is a very superficial muscle, and this means that we only need to inject about 20-degree angle. Frowning again for me. Lovely, and relaxing, supporting the muscle with my finger, superficial injection towards the muscle. And just looking this way for me, and again frowning for me, and relax, and last injection. Remember, needle in the sharp spin, and relax. Alright, and that wraps up the forehead and the frown.
On the left, you can see his before picture, and on the right, his after. And as you can see, his frontalis muscle no longer has those strong dynamic lines that we saw before. Moving on to his frown, his before picture, he looked pretty angry. And on the right, he doesn't look so angry anymore. That's fantastic.